Welcome to One UN, One Voice, a space where we unpack the most pressing issues facing Timor-Leste and explore collective solutions with those driving change on the ground. Today, our focus is on healthcare and well-being, a matter that affects every Timorese family, every community, and the future of the nation. From maternal and child health to communicable diseases, Timor-Leste's health sector faces layered challenges. Yet, with national leadership, global support, and community engagement, the path forward is filled with opportunities. With us today are distinguished guests who bring policy, expertise, and program action to the table. With us today are distinguished guests who bring policy, expertise, and program action to the table. We have Dr. Arvind Mathur, WHO representative. Welcome to the program, Arvind Bhai.
Thank you.
We have Dr. Dominguez Bernardo. She is UNFPA's assistant country representative. Welcome to the program, Mana Dominguez. Thank you so much for joining us today. I welcome you to the program, which is around challenges, barriers, and strategic response within the health sector. Very, very good point. I mean, that actually relates to our next question that, you mentioned about the quality and reliability.
Mm-hmm.
But we as UN, we as WHO, we as UNFPA, we as government, we as other sister agencies, are we supporting, are we doing something? I'm sure, there might be some interventions, support, activities, initiatives, which could build or strengthen the trust among the people that, look, this is reliable, this is quality service, and please, avail this.
So Ahmed Bhai, I'll take the liberty to go on to this one. Both of our agencies and UNICEF, three of us, I would say, have our trust and focus on quality. And not only us, I would say that together with other partners, we keep on harping on the whole element, whole dimension of quality. Quality is something, it remains invisible till everything goes on well.
Yes.
Quality becomes a challenge when things start going bad.
Yes,
that's something which is where one aspect we need to keep in mind.
Very, very good point.
Secondly, people don't realize and understand that quality doesn't come free.
Very
quality is coming only
expensive.
When there is investment, and it is expensive.
Mm-hmm.
And when we start looking into, and that's where we were talking about it in relation to what Dr. Dominguez said about we look into the training on competency based curriculums. So competency, that means standards, and quality comes with these standards and norms. That's our bread and butter as the technical agency. And one of the things which we have done is looking into helping the government, together with our agencies and partners, come up with a quality of care policy and standards. So today, Ministry of Health has the national policy on quality and patient safety, and they have the national standards across the services. They also are one of the 5 countries in the world that have essential service packages for primary, secondary, and tertiary care. They also have standards now, like for example, how does a labor room look like? But they also have a standard for the service that will be provided. So it's not only infrastructural standards, but also the services standard. So if I could say that I'm talking about in relation to the quality, the doctors, the drugs, the diagnostic, the devices, and the data.
Wow.
Yes.
So that's the 5 Ds across which we talk about quality.
And those contribute to quality.
Those contribute to quality. And a few things that Dr. Dominguez can further add, on this element of quality, because we work so much in quality together as partners.
Excellent.
Let me
Dr. Dominguez, yes.
Let me add to Dr. Arvind, UNFPA, WHO, UNICEF. Again, in order to ensure the quality of services, we need to be informed. And UNFPA, UNICEF, WHO, of course, together with the Ministry of Health, to establish maternal perinatal death surveillance and response. What does this mean, this program? This program is a data-driven system which each maternal death need to be audited in order to see what is the issue, what is the weakness of the system, and then to inform for the right intervention in order not to repeat the same tragedy. So this is again complementing Dr. Arvin's statement on the data, why this is very important, that this is one of the key components of maternal health program that since 2015, the three agencies working together with the Ministry of Health, and it slowly is going better, and we can see we have the data annually to inform us to see how can improve the work in maternal and newborn health.
All right. Thank you, Dr. Dominguez. I mean, the next thing I wanted to talk about is coordination and national strategy. As we know that we have, the government has National Health Strategic Plan, and that the question about coordination and national strategy is again linked to what we earlier, both of you have earlier mentioned, that the political will, the ownership of the government, but us UN's role as a supportive mechanism. So how are we supporting the government to prioritize their investments in the right places? Arvind Bhai, first to you, and Mana Dominguez, then second to you from reproductive health point of view, and Arvind Bhai.
Thank you so very much, Ahmed Bhai. And, this is, again, I would say, is our, core area of collaboration with ministries, where we work with them on, helping them in the policies, programs, and strategies. So, that's that's the whole effort that we put it up. And one of the things, Ahmed Bhai, that we try to do together, when in areas where we have the collaboration, but across the broader area of health sector strategic plan, is to start with work on the prioritization. I'll go back to your first question when you ask, what are the major health issues in the country?
Yes.
And which are the priorities that need to be addressed in an immediate term, medium term, and a longer term. And we are very privileged that as the UN and as the WHO, together with our agencies, sister agencies like UNFPA, UNICEF, IOM, ILO, and others, we have been able to work with the government for a long-term health sector strategic plan, starting from prioritization, bringing the evidence-based strategy, the evidence-based, actions that need to be there, and help them develop this long-term. So we have had 2011 to 2030 health strategic plan, and then we worked with them to have a midterm review. We have them a 5-year plan in between, so that there is a operational reality also built into, and the changes. So, emerging and re-emerging threats that happens is, so we work with them in addressing. We bring the whole power of data in the prioritization.
And so that, it's evidence-based.
Absolutely.
It's not based on, me, Ahmed Salim, or Arvind Bhai as WHO representative saying. It's the data which is driving the policies and decisions.
Absolutely. And let me quote one recent example where the three agencies, UNICEF, UNFPA, and WHO, we have all been helping the Ministry of Health with their most recent, the updating the reproductive health strategy, which is for 2026 to 2030. Very recently, we have been working,
which actually aligns with the SDGs.
SDGs as well.
And
this aligns with the SDG. Not only this one, we have the National Immunization Strategy, which is also aligned 2026 to 30, which UNICEF and WHO are working with the Ministry of Health across 3 levels of organizations. So it's not only country office, but we also are able to leverage the expertise from our regional offices as well.
Amazing.
So
amazing.
The effort for us when we work with the government is to bring the best possible technical expertise, the best evidence from the world, the globally, and also, adapt it to the context of the country. Because nothing is important than what the country needs and how the country wants to respond. So the country context is very critical,
important,
actually.
very
So this is how, like our work of prioritization, evidence-based advocacy, bringing the evidence-based intervention and actions,
and leading to the political will and
the political will
and the ownership.
Ownership, engagement with them, implementation, all with the ministries.
And we falling behind the government and then supporting them.
Absolutely.
And interestingly, I would just like to mention here one thing, that these two strategies you mentioned, 2026 to 2030, they align with the SDGs also, but they also align with the UN's new framework, which is being produced at the moment. I mean, it's called United Nations Strategic
Cooperation
Framework, UNSTCF, from 2026 to 2030. So it's an amazing coincidence. It's an amazing alignment.
Yes.
We will just pause. What key lessons from the COVID-19 response, for instance, are now part of the system resilience planning in Timor-Leste?
Ahmed Bhai, thank you so very much for this segment and thinking about innovations, community solutions, and way forward as well. And also, I would say thank you for reminding us about COVID-19.
COVID-19 again.
Because sometimes it seems like it was so long ago that we were, and I wish that we remain free of any pandemic in the coming years as well. That was the pandemic of our lifetime that we have. And for sure, there have been, and there are so many lessons, especially for a country like Timor-Leste, which has so successfully managed the pandemic, actually. Starting from the lessons that the importance of the international health regulation, and Timor-Leste as one of the signatory to international health regulation, and the measures that it could actually implement, including the international border restrictions to begin with, but learning from there how the sanitary fencing at the municipality level when the cases were coming. So from 2020, when the cases were there and then it was contained, and then the borders were getting closed globally, the air traffic was getting curtailed. We remain in a situation of a very low number of cases. But it was a matter of time. And in 2021, we knew that there could be a situation to handle. And I would say that one of the important lessons that we looked into was that we used we call it as a peacetime, to be prepared for the storm. So we were very lucky that the Ministry of Health and the government accepted what advice we were giving as WHO to them. And that included, for example, building the laboratory capacities that was very, very critical for testing. We used that time to build the treatment capacities. So from quarantine to isolation to treatment facilities. Like in 2021, when we were in this situation, the number of critical care beds were so minimal in the country. And in the regional level, there were no critical care beds. So we could augment the capacity of the country health system, that even at regional level today, we have high dependency units and intensive care units. Together with emergency care. So, the lesson was to build capacities, to train doctors, to train nurses, get your, preparedness for response. And this is what we are looking into, that, more prepared we are, easy it is for us to respond in health emergency conditions. And this is where, the power of health communications come in.
That was my second half of the question.
Sure.
But anyhow, you have already
I'm just referring and pointing it out that that health communication plays such a critical role.
Exactly.
Community engagement, ownership by them to be accepting the interventions, and this played a very critical role in the second part, which was COVID-19 vaccination. So, international health regulation, inline public health and social measures, building capacity of the health system and responding to the situation, emergency, treatment and everything, but then preparing communities for vaccination, COVID-19 vaccination. And hats off to the people, hats off to the system. Timor-Leste had one of the highest coverages of both COVID-19 first and the second dose and the booster, but also the 11 to 18 years, the young adolescent, when we offered them the COVID-19 vaccination, we were above 80%
and
coverage.
they also came forward, and the people came forward also, to
Absolutely.
get those vaccines.
And
true,
these
very
are the lessons that we have looked into, and we are now, building in our current systems. For example, now we have there is a national health action security plan. So this health security action plan that we have is now the one which is the guiding document for the ministry, for the government, all sectors, and it is also costed. And we are looking into it as driving the investments. For example, this is the one which helps us to build now one of the lessons that there was lack of epidemiologists in the country, the people who are in the public health in the field. So we have supported the government now with the partner agency like COECA,
yes,
to be able to train the doctors, nurses as the epidemiologists on the field. So we are having a long-term plan with the field epidemiology. We are also sending the health officials overseas for a 2-year fellowship in the advanced field epidemiology trainings in Gajah Mada University. And we are having an intermediary program of 3 months, all done in Timor-Leste. So they are the first cohort of locally in-country trained epidemiologists. They are now available in the country. And they are those who are in the municipalities as well.
So this brings us to the close of the program. Thank you so much, Arvind Bhai. Thank you so much, Mara Dominguez, for joining us today. Today's dialogue reminds us that health is not just a sector. It is the foundation of human dignity, national development, and better future. From policy to practice, the commitment to improve healthcare in Timor-Leste is real. But it will take all of us working together to turn the vision into a reality. To our guests, thank you for your leadership and insights. And to our viewers, thank you for tuning in. Until next time, stay informed, stay healthy, and continue raising your voice for better Timor-Leste. And goodbye, and thank you so much.
Thank you.
Thank you very much.
Obrigado, Bara.